when parents hear words like neuropsychological evaluation or
Hmm.
psychoeducational testing, what does that process really look like? Is that the same thing as you're saying the MFE?
Pretty
Or is that
much.
something totally different?
Yeah, pretty much. So, school psychologists, clinical psychologists, and neuropsychologists, we all have very different jobs, but we have the same tools for assessment. The only difference is, again, training, right? So, as a clinical psychologist, I'm trained in order to diagnose and determine the needs of children and give their, scripted recommendations. Like, here's what we need for ADHD. Here's what we need for specific learning disorders. Sorry. And, anxiety, depression, that kind of thing. A school psychologist is assessing mainly for school specific recommendations, right? They're not doing anything clinical and they're recommending. Neuropsychologists are able to call themselves neuropsychologists because they had special training, a 2-year postdoc after their clinical psych training. And so they tend to work more in hospital settings or they're working with students, children who've experienced some sort of assault on the brain. So, like a traumatic brain injury, they've experienced chemotherapy because of a cancer treatment, that kind of thing, something that impacts the brain. And we're trying to now sort out like what parts of the brain are impacted by this event that occurred. Neuropsychs will still test for ADHD and learning disorders, but they do tend to take more complicated cases.